Cholesterol is a fat-like substance found in some foods and also produced by your liver. Now, people with abnormally high cholesterol are at an increased risk of a heart attack or other heart disease. In addition to high cholesterol, major risk factors for heart disease include smoking, diabetes, high blood pressure, advancing age, and obesity. Not doing regular exercise and a family history of heart disease also put you at a higher risk. The more risk factors you have, the more likely you are to suffer a heart attack. Combinations of cholesterol and the proteins that carry it through the blood are called lipoproteins. High-density lipoproteins, also called HDL or good cholesterol, are protective to the body. Low-density lipoproteins, also called LDL or bad cholesterol, are harmful. Now here's why. Excess bad cholesterol can join with other substances to form a plaque, which can dangerously narrow the blood vessels going to the heart. Think of it like rust clogging up the inside of an old pipe. Your cholesterol may become too high because your liver produces too much, you eat too many fatty foods, or you don't exercise enough. In addition, being overweight and getting older also raise the level. You can reduce your cholesterol by choosing foods that are low in fat, losing extra weight, and doing regular exercise. The blood glucose test measures the amount of a type of sugar called glucose in your blood. Glucose comes from carbohydrate foods, of which there are two types. Complex carbohydrates, found in foods such as pasta, vegetables, cereal, and breads, and simple carbohydrates, also known as sugar, found in fruits, milk, desserts, and candy. Glucose is a main source of energy for the body. After you eat, the sugar level in the bloodstream will rise. This causes insulin, a hormone that is produced by your pancreas, to be released into the bloodstream to quickly bring the level back down. In those that develop diabetes, sugar levels do not fall back to normal after meals. High blood glucose over time can cause permanent damage to the body, including vision loss, kidney damage, and heart disease. There are several conditions that may increase your risk for developing high blood glucose. These include a family history of diabetes, being overweight, and having high triglycerides, a blood fat. Women who have had large babies, over 9 pounds, and those with high blood pressure are also at increased risk. Abnormally high sugar in the bloodstream can cause several symptoms, including blurred vision, excessive thirst, weight loss, and becoming increasingly tired. In many, however, high sugar may cause very minor or no symptoms at all. Because of this, testing for glucose is recommended as part of your routine health care. Colorectal cancer is cancer that develops in the colon or the rectum. Although it's currently the second leading cause of cancer in the United States, it can be prevented. Cancers in this area almost always develop from a benign, non-cancerous growth in the lining of the intestine called a polyp. Although polyps may occasionally cause blood in your stool or abdominal pain, they frequently occur with no symptoms at all. Because of this, it's important for you to be screened for colon cancer as part of your routine health care. Now, one way to check for polyps or other colon conditions is to have a colonoscopy. In this test, a thin instrument containing a camera is used by a physician to see your rectum and entire large intestine. A colonoscopy is generally performed in a surgical suite while you're sleeping. While there is preparation required the day before the test, the actual procedure is usually completed in less than an hour. Now, another way to be screened for colon cancer is to have a sigmoidoscopy. This test uses an instrument that is similar to, but much shorter than the one used for colonoscopy. It allows a physician to see the rectum, but only a small segment of the colon. When a sigmoidoscopy is done, a patient generally is asked to have their stool checked for microscopic blood. This is done with a special kit that your physician will provide. The best way to be screened for colorectal cancer will often depend on a patient's personal medical history. Be certain to ask your physician which test would be best for you.